The United States and perhaps the world are entering an early stage of a healthcare crisis. We have an elderly population that is continuing to age and they're demanding healthcare services. We have indigent patient care issues, and we have escalating healthcare costs. So what are we going to do about healthcare? Well, I believe that one of the things we can do to help is to provide pharmacists with provider status. Is this going to fix all of the healthcare problems? Definitely not. But is it going to help? Absolutely. This would help alleviate some of the issues with the lack of doctors and physicians that we currently have. It would help leave them with their training, and it would help pharmacists use their training that we are trained. At Ole Miss, they provide us a curriculum where we are trained in specific clinical aspects, and we're also trained in what we can and cannot help patients with. And so we could help know when to suggest patients to see their doctors. We could help with medication therapy management. We could help provide vaccines. We could help tell people which over-the-counter medications would be beneficial to them, things of that nature. I work currently as a pharmacy intern, and I was able to schedule a session with an elderly patient. She came in and I called her on the phone, and she was so willing to come in just because I told her that I was willing to help her go through all of her medications. And she came in and she had multiple disease states, and I was able to see that the same prescription, she had a prescription for the same medication from 3 different doctors. Well, she currently did not need those 3 prescriptions, and so I was able to call the doctors and inform them, you know, do you know that this patient is on this medication? Do you know that she's on this other type of medication that may cause an interaction, and it may not let the medication that you prescribed her work most efficiently? So during that whole process, I was able to help her. I was able to give her guidance not only on the timing of her medication, I was able to recommend lifestyle and eating habits that could affect her quality of life. And so I believe that a pharmacist can do way more than specifically dealing with medications. We can actually help improve a patient's quality of life.